invite others. This is a very important matter. And listen to this. They need to come and listen to this and tell us how they are going to help our mothers, how they are going to help those that are less privileged in Nigeria and all over the world. So they must come and tell us. So they must come and tell us how people are dying in Africa, dying in Nigeria. It's not like there's no money in the continent, Africa. What are they doing with the money? What are they doing? So we are going to be discussing all this tonight. We are going to discuss it, and the series will continue every Saturday. It will continue every Saturday. So welcome all. Welcome all. Okay. Welcome all. Welcome. We are going to be talking about, people see it as a taboo in Africa. They see mental health as a taboo. They don't want to talk about it, but we are here to talk about it tonight. We are here to talk about it tonight. We are going to be talking about mental health, how it affects us, what's going on with us. We are here to talk about our health tonight, and we are going to be talking about mental health. the impact it has in our lives. We are going to be talking about it tonight. So join. I'm giving us more time for people to connect. I hope they are not forgotten. Let them begin to connect. Connect is today's Saturday, so that I'm just coming back from work and I'm just coming back, so hopefully we will all join. Yeah, I'm waiting for everyone to join, to connect, for us to connect. It's a very interesting topic, and it's going to help a lot of people. A lot of people will benefit from this. A lot of people will benefit from it. A lot of people will benefit from it. So let's just, I'm going to start. I'm just going to start. I've given us enough time to whoever that needs to connect. I've given us enough time to connect. So if you want to join, you can join. You can join. You can join. It's live. Right. Okay. Tonight we are going to be talking about mental health in Africa. Mental health. When people hear the word mental health in Africa, they usually associate it with madness, craziness, lunacy, and all sorts of evil and bad, bad thing. They associate it with so much negativity. But mental health is not supposed to be seen that way. Mental health is not supposed to be seen as a bad thing, because it's something that can be managed. It's like when somebody we see people having diabetes, hypertension, and they go to meet the doctor, and the doctor prescribes medication for them, and they are able to control the diabetes, able to control hypertension. So mental health is supposed to be seen as such: mental disability, mental illnesses. Okay, before we talk about mental illnesses, let's talk about what is called mental health itself, right? So, because when you say something is deteriorated, we have to also talk about it when it's not, when it's okay. So then everything that is negative has positivity as well to it. So that is why we talk about some positive parts of it as well. So when we say mental health, is a state of well-being in which an individual realizes his or her own abilities. They can cope with the normal stresses of life. Also, they can work productively and they are able to make a contribution to his or her community, right? So, but the World Health Organization defines mental health as more than just the absence of mental disorder or disabilities. So peak mental health is about not only avoiding active conditions, but also looking after ongoing wellness and happiness. So if someone is contented, the person said, I can be able to take care of myself, I can be able to do things that everyone else can do, go to work, school, cook, be able to go on the road, and we are, and it's fine. Oh, wait, I need to, oh, people are saying that they missed. People forgot, they forgot, people always forget. Let me just tell them. Hold on. Let me just tell them to join now. Right, so that's basically what health is. So it doesn't matter, it doesn't mean that if someone is having maybe slight pain, or maybe the person is not feeling so well, feeling low, and the person can take care of themselves, doesn't mean that that person is sick, or the person has mental health disability. So it's only Africa, they have a stigma with mental health. Only Africa, they don't look at mental health the way it should be. So mental health problems has increased in Africa, and it's very important for us to discuss its effect and relevance in our society, because whether if we don't talk about it, it will still be permanent. So that is why it's very important that we go through and we keep talking about whatever it is, what effect has it caused in our lives, in the society, people having issues, stress. There are so much stress in Africa. So between 2000, the year 2000 and year 2015, Africa population grew by 49%, right? The population grew by 49%, but there's a problem. During this growth of population, the number of losses, number of deaths, number of mortality increased due to mental health problems, due to substance abuse. So all this increased by 52%. So that means 49% of people are 49% of increase in population, but 52% are now affected with mental health problems. So obviously, with that said, so sorry about that. The connection. What's wrong with my connection? Okay. So right. Okay. So that means as the population is increasing, so is the problem is increasing with men. neglected in Africa health and development policy. The agenda, they never put it there, is all negative. All the things we hear about it is negative. Politicians, in Africa, international development agencies frequently overlook the importance of mental health. They don't look at it. So there are some factors that I kind of researched to this effect. So we talk about ignorance about the extent of the problems on health that mental health has on health. So they overlook, and this process of overlooking what people are going through with mental health issues makes it, it now makes it so difficult for people, to be treated. So now, the second issue, the second problem that I can bring out is stigma. Stigma associated with mental disorder. So there are people that have these mental health problems, and because of the stigma, they cannot come out and say, I have mental health problem. There's something is not right with me. I need help. I need support. I need to be seen. So this is another issue that we find from there as well. Hold on. Oh, God. What is this? So, right. So the hold on. Right. So, yeah. Now, another thing, another problem that if we face, why the politicians in Africa, International Development Agency, frequently overlook the mental health problem in Africa is misconception that mental illnesses cannot be treated. There's so much misconception about that. They misinterpret it, and then they believe that, oh, mental health problems cannot be cured. Mental health problems cannot be treated, cannot be managed. When somebody is mentally deranged, according to how they put it, oh, the person is mad, the person cannot be treated, the person cannot be helped. So with all this, it makes it difficult for these individuals to even get any help at all, right? So what is mental health disorder? We've talked about mental health at its own degree. And we talked about what the World Health Organization identifies or defines mental health to be. But what is it? Because if we are healthy, and we know that up there in our reasoning, we are sane and we are in a good state. What about the opposite of that, which is mental health disorder? So mental health illnesses are a group of abnormal thoughts, perception, emotions, behaviors, and relationships with others. So that means the perception that the individual we have will be totally different from, the behavior. It will affect their thoughts, it will affect everything, their emotions, affect relationships with others, how they relate with others, there will be problem with that. So there are different types of mental health problems. Depression is a mental health problem. Bipolar is another mental health problem. Schizophrenia is another mental health problem, which we'll be discussing from week to week. We'll be discussing one after the other, because all this affects our Africa, the continent as a whole. So in schizophrenia, we have so many types of psychosis. So many types of psychosis with mental illnesses associated with schizophrenia. So we have dementia. I remember my grandmother having dementia in 1990. And I didn't even understand what it is, how to manage her. But now we can see that dementia is also a mental health problem. This is an illness that affects mostly the elderly. When people get to a certain age, when you get to some certain 60, most people begin to develop when they have cognition problem. So where people begin to forget things, they don't remember where they are, they can't even remember their names or things like that. So, and it progresses because dementia is a progressive illness. Dementia has no cure. So it's a progressive illness. So it's part of mental health disorder. The same, so that's why it's very important that we know all this and we understand all this, because it is a big problem in Africa today. As I'm speaking, like what's going on in Nigeria is a big problem. These people that are killing others, there are a lot of mental health problems. It's very important. I would advise you to share this link, share the link so that other people can join and hear me out. I'm taking my time to do this for people because I see every day people are being killed. It's mental health problems. We are not talking about it. It feels like if we talk about mental health problems, it's like a taboo. It's like, oh, it's no go area. But it's the genesis of most of the problems in Africa today, because it's not well looked after. The people with mental health problems, they are not well cared for. They are not medicated. They are not given any psychotherapy interventions, no psychosocial interventions, nothing for them. How do you think, no psychological intervention, how do you think these people can be treated when all these are not in place for them? And we keep shouting, people are being killed, people are killed. They killed a young girl, a husband killing wife, wife killing husband, and and people getting burned and all that. All these are as a result of mental health problems, because there's nobody that we just come up and say, you know what, I'm going to do this to somebody else if there's no issue on ground with mental health problems. So I would say, let's look into all these situations, and then we can now identify what we can do to help the situation. What can we do as a citizen, as a human, as a woman, and also more as a mother and father? How can we help the situation? So mental health disorders, there are many. Even autism is classified as mental health disorder. So causes of mental health disorder, it is a combination of biological, psychological, and environmental factors. There are so many, they are linked up to so many. So where you have people, maybe someone in your family that has the mental health disorder. It could be genetic. It can be genetic. From there, it can. For example, people that are. I remember someone that the mother died as a result of having a mental health disorder, which is early onset. She was I think 50 something. She had dementia, and when she had dementia at 50 something, that struck the woman, because her mother, because when people with mental health problem, when they are not well cared for, they have the mortality rate is low, so it's high. I mean, so that means their life expectancy drops. So if, for example, someone that is supposed to live for like 80 years, with this problem, the person can actually live for like 60 years because it drops. Yeah, it drops. So it is good for us to follow this up. Many Africans don't want to talk about it, but it is something, it is very important for us to care about ourselves and our loved ones, especially those in Africa, because the way it's going, a lot of people will keep on having the same issues. So the causes: childhood abuse, people that are abused, that have gone through abuse, emotional abuse, physical abuse, and so on and so forth. They are traumatized with all this. Abuse can traumatize people. Abuse can traumatize people. And people in Africa, they are prone on being abused because, every day they live their life in fear. It's so sad, but that is it. So trauma and neglect are causes of mental health disorder. So social isolation, when people isolate people, can cause it. Loneliness can cause it. Discrimination, stigma can cause it. And especially in Africa, the social disadvantages, poverty, debt. When people are in debt, poverty is very easy, they snap, just like that. Somebody once said that there's a thin line between insanity and sanity. So it can snap, immediately snap, and it becomes a problem. Bereavement, people cannot get over when they lose their loved ones. They cannot get over it. It becomes, and they didn't go through a process where they debrief them. When you lose somebody, there's a process for such a person to be debriefed, for such a person to go through therapy and go through a kind of intervention where they will talk the person out of that thought, because it's not easy to lose someone, especially loved ones. When people that lost their mom, their dad, and some of them, they lose in Africa, mostly in Africa, they lose their loved ones through, we all lose our loved ones through one terrible way or the other. So that thought about it becomes an event that stays in the brain, and people are traumatized with those kind of those events. So if we do not talk to such person, they don't intervene, you don't intervene and let the person go through therapy, it will just become a problem. By the time you know it, the person has snapped and it becomes a mental health problem. Stress, long-term stress, long-term physical health conditions, those are they are causes of mental health problems. So, right. So the demand for mental health services is increasing in Africa daily basis, especially for women and children. I'm very concerned for children that have been through a lot and they cannot speak for themselves. Women are traumatized every day in Africa. Women are being raped and they'll keep quiet because it's a taboo. Who are you going to tell that someone raped you? Some women are even raped by their father's best friend, those that are in their neighborhood, their neighbors and all that. So many. It's so sad because there's no law, there's nothing. They said they have, no, even if you report it, who will believe you? So it's high time that we look into all this area for those women and the children. Most African governments, they budget a very little money for mental health services. So the budget doesn't promote mental health services. Evidence-based intervention is a frontline method of treating mental health in low-income countries. So obviously, it is what you see. If they don't see it, oh, is that person on the street? Without that, oh, the person is okay. There's nothing wrong with that person. So they do not even look into it. So we're going to really talk about today, we're going to talk about depression. We're going to talk about depression as a slow killer. It's a slow killer. It's something that is hidden. It's known as a silent epidemic, depression. So next week, Saturday, we'll be talking about substance abuse. Substance abuse, that is illicit drugs use that we talk about mental health associated with illicit drug use, which we call here in the UK dual diagnosis. So we're going to talk about that next Saturday. But today we'll talk about, because it's vast, we keep talking about things that are affecting us. And my hope and my aim is that more light will be shed into it. I want this to get to the government. Let them be ashamed of what is going on. So let them be ashamed that they are not taking care of the root of the problem. Because before you want to talk about things, you have to go through the root of the problem, and then you can now find solution to that problem. So depression is characterized as, sadness, loss of interest or pleasure, feelings of you having feelings of guilt or low self-worth, disturbed sleep or appetite, tiredness or poor concentration. It is very easy for people to say, I'm tired. Oh, this problem just came. I cannot even eat well. I cannot sleep well. Oh, I have that. So with all this, because the depression can mask itself in a person. So it's very, very difficult for people to even identify that they are depressed. Some people even use it wrongly. They just say, she's depressed, he's depressed. And they use it wrongly without actually seeing what is going on with that person. They just take it as if it is a norm. But depression is deeper, is larger, is greater than that what people take it to be. It's killing people on a daily basis. The most prevalent mental health illness in the world today, currently estimated 100 million people in Africa suffer from clinical depression. 66 million are women. 100 million in Africa, and 66 are women. The World Bank consider it the greatest thief of productive economy life. So it is a huge matter. The yearly global cost from mental, neurological, and substance use disorder is estimated at between $2.5 to $8.5 trillion yearly. So you can imagine You can imagine the amount, how this thing is affecting us. We need to be talking about it. We need to talk about it until those in the offices will hear this, in that power, that their governmental offices, they will hear and they will attend to us, because we will not allow our sisters to be brought down by this silent pandemic. So even with this 2.5 to 8.5 trillion, it is estimated that the figure will double in 2030. Mind you, we are in 2022. So in 8 years from now, this figure will double. It will double. You can imagine 2.5 to 8.5 trillion dollars yearly. That is what this mental health depression is taking from us. Research shows that mental health services provision is being neglected, particularly in developing countries such as, Nigeria and all that. So women are more neglected. Women are the ones that are suffering from this problem so much. So who did that is World Health Organization survey. They did a survey due to the pandemic. Due to this pandemic, this COVID-19 pandemic, the demand for mental health services and programs have increased. So therefore, it has increased. So people are just looking at it. The depression has increased. People are being depressed every day. Every day, depression. Research shows that exposure to mental health services has helped individuals to benefit in managing stressors brought by the pandemic and other issues of life. So when people are exposed with such as I'm doing now, they understand what it is. It helps them. It opens them up. The awareness comes, so they know what they are dealing with, and then they can seek for help to help them cope with the situation. United Nations in 2022 policy, they made a policy brief on COVID-19 and the need for action on mental health. So the awareness is coming up, which called for an increase in global mental health service to help families during the COVID-19 crisis and beyond. So this is, COVID-19 is still there. People are still, I heard that someone died from COVID-19 in North Korea. So COVID-19 is still affecting people every day in the hospital here. We are still having patients that are having COVID-19. So majority of women in Africa do not have access to mental health services. The awareness of it, importance is another issue. They don't know that is important. The stigma attached to mental health is a bigger problem today. That woman, don't go associate yourself with her. She's mad. She's a mad woman. She's crazy. So there's a stigma attached to it. It's time we stop this. It is time we put a stop to this. Depression is the #1 cause of disability in women in Africa. A woman is afflicted at twice the rate of men. So depression affects more women than men. Most African governments spend less than 1% of allocated budget on mental health. They don't spend 1%. What will 1% do? And they say less than 1%. So they are not even interested in mental health in Africa. They just disregarding it. And it's the mental, if somebody's brain is not working properly, how can the person function? The person cannot function in anything. So if we do not talk about the importance of mental health, how can we have a successful economy? How can we have a people that will be competent to do their jobs? That is why we have people in the offices, governmental offices, where things are done in the way they shouldn't be done, because they don't look into all this properly. The most important issues, the things that they will look into, they will not look into it. Rather, to be looking into wrong and wrong doings. So, due to lack of recognition and investment in the related services, 85% of people suffering from depression cannot access care and treatment. They cannot access care and treatment. So, we are just locked up. So, there's an article, Lancet Global Health article. They found that mental health in Africa, that is the topic of what they named it to be, that there are 1.4 mental health workers per 100,000 people in Africa, despite the challenges of the continent's weaknesses in the provision of mental health services. So that means it's like 100 people, you have 1.4, that is 1.4 workers. How can that be? It's not even up to 2 people, 2 workers to 100,000 people. It's really backwards. It's really backwards. It's really backward. We must change our narrative about mental health in Africa and do something better for our people, because it affects everyone. Mental health doesn't have, and it doesn't have a sister or, oh, this is rich or this is poor. Mental health can affect anyone. This mental health disorder, mental health problems can affect anyone. If someone is saying, oh, I'm in office, it will not affect me, you are lying, because mental health can affect anyone. Dementia doesn't call for anyone, it can affect anyone. So it's better for us to realize this right now. Let's realize the problem, and let's put a more effort on how we can change lives. If we compare the rating of other countries, like in other places, we find out that global rating of 9 per 100, so at least 9 people to 100,000. So at least that is a lot better. Other areas of concern are lack of psychiatrists. We don't have psychiatrists in Africa, in Nigeria, in Africa. They are all leaving. Why? Because they are not well paid. They are all leaving. You can imagine a psychiatrist or a mental health nurse that is being paid, like, for example, they are paid 100,000 or 50,000 in a month. 100,000 compared to the money you get abroad is nothing. 100,000. If a psychiatrist is getting 100,000 a month in Nigeria, for example, because that's where I come from, and they get in the UK or in the US, they get like 1.5 million a month. What would you think they would do? Even that 1.5 million is, I will tell you, is even a chicken chain to them. So, for example, they get 4 or 5 million. Yes, so there are some doctors, psychiatric doctors, that earn up to 5 million a month or more a month. Some can earn, more than that. So you can imagine if they are working in Africa now and they are getting 100,000 or 200,000, they won't want to stay, because first of all, you are not providing for them to be able to stay in Africa. You are not making them comfortable to do their job properly. So they will look for a place where they'll get more money, they'll get comfort, they'll be respected, they will grow, and so many things for them, so many benefits for them, because you are not providing it for them. You are neglecting them as a government. So that is one of the problems. The number of hospitals and beds for people with mental health difficulties, those are another problem, right? So those are another problem. Right, so we're talking about depression as a mental health disorder. Depression as a mental health disorder, right? So the availability of outpatient facility, that is community services, is not available in Africa. It's not available. Lack of availability has put innocent people's life at risk. My heart bleeds for Africa. My heart bleeds. We need to change how we treat our people. Another concern is around the number of Africans with mental disability, how they are being treated is very, very low, the way they are treated. It's so sad that we talk about so many things, but we don't talk about the mental health problems that is, our country we are facing. I think it's time we talk about it. It's time. So, how depression has never been an African disease. So that is one of the beliefs that causes the problem in Africa. Most people in Africa, they don't believe that depression is an African illness. They don't believe. They believe we don't have things like that in Africa. For example, in South Africa, 75% of people suffering from mental health conditions have no access to care. In Kenya, 0.05% of the country's budget is allocated for mental health. Very peanuts. Peanuts. In Nigeria, 10% of people with mental health issues have access to a psychiatrist or health worker. So it's 10% of people. Only 130 psychiatrists are available for the population of 174 million people. Only 130. This is the amount. It's not even up to the amount that are, that can even be in a city. So it's good sometimes look at what we are going through. Just look at what Africans are going through, and you think that this is acceptable, when we don't even have the the right what's it called? We don't even have the right services. They are not provided. We don't have the right services for mental health in Africa. People are just suffering for nothing. They are suffering and no one is taking care of them. No one is looking at them. No one is seeing them. They just look at them and, who are you? And that is it. So it is so unfair what is going on in Africa. It is so unfair. what we are going through in Africa. So I would say now, if we change the narrative, if we change the narrative of what is going on in Africa, we'll get a better solution. Because we cannot be talking about, yes, we want to do something good for Africa, whereas we are not even touched the surface of what the problem is. What is going on in Africa? How can we make this better? How can our mothers, how can our fathers have a better health care, mental health services that will help us in the future? So I would say, let's look into this properly. We need to look into it properly. We need to look into it properly. We need to look into it properly. So, World Health Organization estimated that the number of mentally ill Nigerians range from 40 million to 60 million, with disorders such as depression, anxiety, schizophrenia, which are common just like other African countries. In 2012, Ghana passed an Act 846. That's the act that was passed to address its mental health problems. This is known as the Mental Health Act. So they passed it in 2012. So they've gone further to identify that there's a need for interventions. So they became one of the few countries in Africa to set up a policy towards mental health. But earlier in the same year in Ghana, the Human Rights Watch, HRW, estimated that 2.8 million Ghanaians out of a population of 25.9 million had mental illnesses. Sadly, 97 out of the 100 mental health patients have no access to services. We need to change what we are doing for these people, really, because mental health problem can happen to anybody. That is one thing I want us to understand, that mental health problem, people think that it cannot happen to them, but it can happen to anyone, because there are so many triggers. Post-traumatic stress disorder, when things have happened in people's life, substance abuse is rampant now in Africa. People are taking drugs excessively, highly, and deeply. People are on drugs. Drugs is the number one reason why people are harming the others. I tell you, it's a big issue. Unemployment is another thing. Unemployment is a big problem. Violence, abuse, crime, civil war, the war that was experienced by Liberians and Sierra Leoneans. The war they experienced, the only psychiatric hospital in Sierra Leone was the one they built since, during the slavery time. And it was established by the British to rehabilitate, people. Hold on. Before that one we turn, before it turns off, I need to connect it.
Recording in progress.
All right. Sorry, my other phone turned off, so I had to reclaim it. So, okay. So it's all right. So, like I was saying, all right, so yeah, so that is basically about what we're talking about. So the civil war that happened caused a lot of problem in these individuals in Sierra Leone and in Liberia. I mean, I've been to Liberia several times. I've been there several times and I know a lot of Liberians. So I can categorically tell you that the war definitely affected them. It affected them. Most of them are not educated because of that problem. Those ones, though people are going back, I know a lot of them that are going back to school now. But that war, it deprived them from so many things that they would have done for themselves. So, the hospital, the psychiatric hospital in Sierra Leone, the patient nurse there presently are in dehumanized state, in chains. They are chaining them. In Africa, they chain people that are related or associated with mental health disorder. They chain them, mostly young male and from 40 and below. The hospital is barely functioning. Part of it is tearing apart, so obviously is dilapidated. So 450,000 people from 7 million suffers from depression yearly. In September 2015, the UN General Assembly recognized for the first time mental health and substance abuse as a global priority. So what are we doing for these people? They've recognized it. In Liberia, 27% of the survey out of 1,600 households had experienced substance abuse related problems. So they had mental health problems. This is getting worse daily. So every day is getting worse. So there are things attached to it. People are not, the government do not care. They are blaming those seriously hooked in substance abuse as they brought it upon themselves. So that's the mentality in Africa. Oh, they are the one that took they went to take drugs, so they should kind of suffer for what they've taken and things like that. But it is not supposed to be like that. We're supposed to rehabilitate these people, treat them well, and let them realize that what they're doing, whatever they put their hand, is not right. So spiritual or traditional intervention. So belief of the people that mental health illnesses is caused by some spiritual powers. So therefore must be cured by prayers, sacrifice, herbs, and so forth. So that is belief system, the belief system of Africans, that this is not an ordinary situation, so must be dealt with spiritually. So this practice is mostly in Nigeria. So most common sufferers of mental health disease are seen roaming in the streets of overcrowded cities, such as in Lagos, the way we see it in Lagos, in all parts of Nigeria, the big cities. So they are so poor. These people are poor. They are unemployed. They are dirty, filthy, and therefore designated as vagrants. So some of these vulnerable individuals are held in hospitals and treated like prisoners, chained and beaten instead of being treated. Probably they are not getting the right treatment, because over the years, what happens with mental health problem is that when when it's not well treated, or when there is a mental health disorder, a person is experiencing mental health disorder and they are not treated immediately and is left for over time, it will become worse and more difficult to treat. That's what it is, more difficult. So the more it's prolonged, so the more difficult it becomes to treat. So when they are left on the street for many years, some of them like 10 years, they are not treated, nothing, no medication, nothing, nobody's checking on them to see how they, instead you are going there to beat them. How can you be beating somebody that is unwell? It's like somebody having a diabetes, now you are going to beat the person. Will you do that? So this is so sad what they are doing to people over in Africa. So in September 2015, the United Nations General Assembly included mental health problems and substance abuse in the Global Sustainable Development Goals. So they have it already in place. So United Nations has declared it as an enemy of the people. So it's there. So why are the government not making use of what has already been set up? So they take money for mental health problems and they don't use it for mental health problems, use it for something else, or what? We need to know. We need to know, because it's well written here that they are aware, and it's been written as a global sustainable development goals. So that means it's one of the target points where all nations, all countries, all community needs to attend to. They are it's well recognized that mental health problems is a huge problem in society. So why are they not looked into? Why are people still on the street and they are not well taken care of? Why are they being beaten? Why are they being neglected? Currently, Africa countries' budget, obviously I've talked about it, is less than 1% that they are using, whereby it is it's written, they are evidence-based that the supply of funds for mental health. So why is it not looked into? What is going on in Africa? So while in Europe and North America, 6 to 12%, 6 to 12% budget is being allocated for people with mental health problems. So why is our home less than 1%? We need to start to ask ourselves questions. So anybody that wants to come and say, you know what, I want to come and I want you people to vote for me to come into power. Have you thought about what is going on, the genesis of the problems, the mental health problems that people are facing over the years, where they are not able to take care of themselves? Poverty has brought mental health problems, mothers killing fathers, mother killing children, throwing the children away, and children killing their parents, husband killing wife, wife killing husband. Do you want to know what is going on? Have you checked them out? Have you supported them? So these are the questions we need to be asking. We need to be asking ourselves. We need to be talking to ourselves. I will employ us to really look into this, because Africa needs to increase the budget on mental health. You need to increase the budget on mental health disorders. So because there's poverty in Africa, there's infectious diseases that can affect mental health. There are some diseases, even when they have malaria, malaria can make someone begin to display some mental health symptoms. So what are we doing about all that? Maternal and child mortality. People are dying, children are dying, mothers are dying. They are having traumatic stress disorder. They are having it. So what are we doing about it? Low income. People are suffering because of this low income. They have so much to do, they cannot do it. And they keen to develop mental health disorder in Africa. We have to be wise. High prevalence of communicable disease has also added to the problem. Malnutrition, low life expectancy is also comorbidity. All these are issues that have brought this problem. So let's look into it very well and see what we can do for our sisters, our brothers back home, right? So interventions. World Health Organization endorsed group interpersonal psychotherapy sessions, group identifying causes, triggers, and formulating coping strategy to overcome depression. Depression is episodic and recurrent, so it can happen, over the years, and depression can be episodic, so it can be now and that's fine, you to go and come back again. It's just like that. So sometimes people can be high and people, so depression is huge, is there in Africa, and people are overlooking it, and they just say, oh, this person was just angry. When Nigerians, we come abroad or we go out and people say, why are you people so aggressive? You're aggressive. My dear, it's part of the problem. It's part of the problem. We are not aggressive people, but we've been through a lot. We've been through a lot. So that is why, because there's nobody that you'll be talking to that wants to scream or shout or, be aggressive, unless the person does not even recognize that you have that problem. Most of us abroad, we have that same problem because we're shouting when they're talking. I say, why are you shouting? Relax yourself. Nobody is quarreling with you, but you just be quarreling with yourself. It's out of all these problems. Depression. We need to look into it. It's a big problem in Africa. It's a big problem. So I would say, there acquire skills to help manage the immediate and long-term effect of depression. There's a group called Strong Minds. It's an organization scaling this cost-effective solution to help end the depression in Africa. Strong Minds, they are working in Uganda and Eastern Europe. And Mental Health Foundation, they are working in Nigeria. Mentally Aware Nigeria Initiative, they are in Nigeria. NIM Foundation, they are in Nigeria. She Writes Woman, they are in Nigeria. Love, Peace, and Mental Health Foundation, they are those that can help. And I will just stop here today, and I will see us next Saturday. I hope we can keep joining. We keep joining this meeting. It's very important because our voices must be heard. We are not going to be voting people that will come up and be taking us for granted. Use the money allocated to take care of those that are on the street, those that are sick mentally, and then they will not do what they're supposed to do. No to injustice. We are going to be shouting, we're going to be calling on them, and until they listen to us and do what is right for our people. Okay, thank you everyone for this evening. I would say please join me next Saturday so that we can put this really well. We are going to be talking about substance abuse next Saturday. So please join me. Thank you, everyone. Bye for now. Bye-bye.